Okay, good afternoon, everyone. We'll call to order this meeting of the weekly Commissioners Finance meeting today, June 15. Our appointed hour 1:30 p.m. Drive will begin. We have first order of business is an opportunity for public comment. This is made available at all public meetings. Anyone wishing to comment, we ask you to keep your remarks to about 3 minutes, roughly speaking. And we ask you to identify yourself by name and municipality in addressing us, so we have that for the record. And we believe we do have one member of the public, Mr. Baker, is here to address the board. So
also now a member of the PHRC for Cumberland County. And some of the reasons that I ask these questions is about discrimination. And Lower Frankfort and everything is playing a game with this pipeline up there. They've had a breach in the pipeline. They got volunteer fire people that are living within the blast zones and they're not being trained. I offered to train them as my hazmat experience. They said, no, they didn't want to do that. I said, all right, that's fine. So you have these volunteer fire company and granted, they should be getting $250. They should be getting more for tax for real estate. So I got to ask this question, and this might be a sore subject to you. But who's the first responders down there at Claremont Farm where the pipeline goes right by them and they're all living in the blast zone? Is it the volunteer fire company people? Are they being trained so that they can take the old people out of there? Or is there going to be a private force from this company that just bought Claremont? Because those people, they are living in a blast zone, same as I am and all the people up there in Lower Frankfort, Upper Frankfort, wherever you want to go. The PUC said about this, it's now 1,500 feet. Sunoco is supposed to be sending out magazines every 2 years to warn the people of the dangers of this pipeline, which they haven't done. They refuse to put a warning siren up, though the supervisors up where I am have a warning siren at the pump house because they all live up there. And I find it almost unbelievable that we have people in the public that aren't even aware of this pipeline that I fought for years over. And then you turn around and you got a place like the old folks' homes that are in blast zones. They're Westchester, they got elementary schools right up against these pipelines and everything. So this pipeline, since they're making billions of dollars, now this is just an opinion of mine, they should be paying to train these volunteer fire companies to the best of their ability and have a professional team on standby. They don't have that. Up in the pump house, right around the corner where I live, they had a gas leak in March. A fire company came to it, and then the township got angry because Sunoco was supposed to be there first and then called for backup. Now Lower Frankfort's saying that they're backup under Mira. I don't know who's getting all this money and education and everything supposedly to protect the people out there. But then I go right back to Claremont Farms. And they're all in the blast zone. So if they have a leak in the gas line, is the fire company supposed to stop doing what they're doing on the breach of this gas line and evacuate the people in the old folks' home? Or are we just going to leave them there to pay the price? That's my comments to you. I just asked my opinion that Sunoco be made to train these volunteer fire companies. They have the money. They donated $18,000 to Lower Allen Township to buy a new fire truck. Upper Frankfort, with all their bazaar and everything they're having up there, they're now going to buy $1 million fire truck, which is great. But it doesn't do you any good unless you're trained. Hazmat. They should have self-contained breathing apparatuses, chemical suits, and everything. And since they don't have it, Sunoco is putting these poor people here, these volunteer fire people, harm's way. They're in jeopardy. And everybody else that lives around that pipeline is in jeopardy, whether it be elementary schools, old folks' homes, anybody 1,500 feet on both sides of that pipeline are in jeopardy. And they sent me a magazine which got me involved in this to begin with. And the magazine said, if you wake up in the middle of the night, parentheses, if you wake up and you smell an odorless gas, proceed up the window. Well, if it's odorless, how can you smell it to proceed upwind. Do not turn on your light. Do not use a cell phone. Don't use a car because they're emission sources. In Lower Frankfurt, we have a cell tower 500 feet away from the pipeline. It knocks birds out of the sky. You ever see birds roosting on cell towers and the radiation knocks them down? This is 500 feet away from this pipe. And nobody seems to know about it or care about it. So all I'm asking is that Juns get involved, because you were involved in my PUC case. That Juns get involved and enact something to have these volunteer fire company people trained to the best of Sunoco's ability. Millions and billions of dollars are getting. They dangle $18,000 in front of Lower Allen and say, here's $18,000 for a fire truck that cost $1 million. Big deal. They should be paying these volunteer fire company people and have a professional team on site at all times to be the first responders, and then have the fire company come in. I had a fellow named Mike Chestnut.
I need to ask you to wrap up here.
Okay. Okay, I had a fellow named Mike Chestnut. He's a fire lieutenant for North Middleton, I believe. I asked him what his role would be in the breach of a pipeline. He said, we're to barricade off that thing, and anybody on the other side of that, you're on your own. That's all I have to say.
Okay. Thank you. I just want to clarify. I want to ask a question of the solicitor here. So my understanding now, because of the nature of local government in Pennsylvania, is that local response on this issue would be the responsibility of the townships. Is that correct?
That's my understanding.
Okay. All right. We do not have, county government does not have any enforcement power here. I know we were involved in your case. That, as I understand it, was a matter of the county signing on with essentially a public declaration of support by the commissioners for your case. I don't believe we had any attachment to the legal proceeding because we could not, my understanding. So there are regulations in place. I'm not familiar with what these regulations are. You seem to have significant familiarity with them, but we are in a position to lend support, as we did in your case, if there is an action, particularly legal action that will be filed, claiming that there's violation of the regulations that are in place. That would be a role we could play. In terms of this issue, we are simply trying to do our part in expressing support for our volunteer EMS and firefighters at the local level by extending a tax credit on their county property taxes. I don't know that we're in a position to extend additional requirements on individual companies in regards to requirements that they have certain training or anything of that nature. It strikes me that that's a little beyond the reach of the county government and certainly beyond the reach of this ordinance.
Right.
So, I mean, we can make an inquiry with public safety again so that we more fully understand if there's any responsibility or opportunity for the county government to ensure greater public safety here. I'm not sure what that would be at this point. So, but we appreciate your comments. They will be part of the record.
Right.
And that is my understanding of the issue at this point, that we are a very limited role in this.
Right. The county has little authority over regulating an entity that's regulated by the PUC. I understand what you're saying. You want Sunoco to pay for everything. That's something that this board cannot mandate. Perhaps through the PUC it can be done, but this board certainly does not have that authority.
Okay. The PUC, after I won my case and everything, I was supposed to have a public hearing here. And it was kind of nixed because of the COVID thing. They then turned around and had a public hearing in August last year. Okay. And I wasn't satisfied with that because they didn't basically get down to the bottom line of it. But the pipeline is not following the PUC's orders that every 2 years magazines are to be sent out, that the people are to be trained, volunteers are to be trained to respond to a pipeline, that they're supposed to have some kind of professional people. They refuse to put a warning siren up there, putting people in jeopardy and everything. When I started this, I asked my township if we could have a public hearing. 2 hours before the public hearing and everything, Sunoco bailed out and called the state police. We had six state police come there. We had people from Westchester and all over the state of Pennsylvania there. They turned around. When they seen everybody was over 50 years old, they laughed. 4 of them left, 2 stayed there. To make a long story short, after the meeting was over, the township, they sheepishly got out of there as quick as they could. The 2 state cops come up. They come up behind me and my partner. They said, off the record, we were told to arrest you if you stepped out of line, Mr. Baker. So Mr. Baker turned around and filed a PUC charge. The PUC didn't want to have an open hearing. All they wanted to do was have something over the telephone. I kept persistently going after them, and I finally got a public hearing at 1. But to this point, we still do not have the protection that we need.
I'm not familiar with what the PUC opportunity for an appeal or a complaint filing is. It would seem to me that there's, your issue is with the PUC is what it sounds like.
Well,
so there would either be a complaint filing or a lawsuit again. I hate to say that.
I filed a second complaint with the PUC because while I was waiting for their original thing, they dumped 140,000 gallons of hydraulic fluid in the creek behind my house. And then they turned around and dumped another 18,000. I filed a complaint with the PUC. The judge then turned around and denied it. She said, we're all out of the construction period. We're now in the DEP. DEP, Josh Shapiro was down there in Marsh Creek, fined them $5 million for dumping that. They did a quarter of that in the creek behind my house. And then they lied to DEP and told them it was only 1,000 gallons. Most of it was in Middlesex. They don't.
Yeah, I'm going to halt you there because this is way outside of our.
Mr. Baker, I don't know if you're familiar with the local emergency planning committee, but I am the commissioner liaison to that. How about if I get you a contact with them? They really are responsible. They develop the plans for public safety responses. So let me get you in contact with someone there and that I think could help you.
Alrighty, thank you very much.
That might be a lot more productive than anything.
But I do want you to know that after the state police were there that July and everything, August, Gilroy, which was their solicitor, turned around and said, well, you're the local township. You have no jurisdiction here. And they passed it on to Jim Hertzler and Ewens.
Right.
I mean, they gave Ewens, where we had 3 meetings here designated to have, and Sunoco bailed out of all 3 of them.
Right. Yeah, we're pretty familiar with the shortcomings here, and we're very sympathetic to the issue you faced. It is nice to get an update. But I think we pointed you in a direction now.
That would be great.
That will hopefully be productive.
I'll do that.
And,
I'll do that before I leave today. I'll get you an email.
I don't do email because I was a welder for 37
That's
years.
right. Before you leave, let me just make sure I have your phone number. And I will
That'd be
get you
great.
connected.
Yes.
Okay.
Thank you for your time in this matter.
Sure. Thank you for your interest in our meetings. Do we have any additional individuals interested in public comment? Anyone online? No one online? Okay. With that, we'll move on to item 3 on the agenda. That is the approval of the minutes of our previous meeting on June 8th. So entertain a motion.
Move to approve minutes of June 8, 2022.
I second.
Moved and seconded. If there's no further questions, all in favor indicate by saying aye.
Aye.
Motion carries. That brings us to item 4, which are the 2 business items of the day. We have topics for discussion. The first is in regards to the ordinance that we just held a public hearing on for providing real estate tax credit for our active volunteer firefighters and volunteer EMS personnel, meeting the qualification standards set forth in the ordinance. So at this point, we'll open the floor for discussion among the commissioners and staff in regards to possible action on that ordinance.
Commissioners, I mentioned during the hearing, because of the 30-day period required by law, I would be asking you if you're inclined to adopt the ordinance to approve ordinance 2022-2 and execute it with an effective date of July 6th, 2022.
Okay, so if there are additional questions or comments, now would be the time. Otherwise, we can entertain a motion for approval.
I don't have anything further.
No question. I think everything's been asked and answered over time here. So we'll accept the motion at this point if it's so, or so inclined.
So I will move to approve ordinance 2022-2, which is an ordinance of Cumberland County, Pennsylvania, providing for a real estate tax credit for active Cumberland County volunteer firefighters and volunteer EMS personnel residing in Cumberland County.
Can I ask that the motion be amended to include effective date of July 6th?
Yes, thank you. So the motion is amended to make that ordinance effective July 6, 2022.
Second.
Okay, motion is on the floor and has been seconded. If there's no further comment or question, we'll call the action. All in favor indicate by saying aye.
Aye.
Motion carries unanimously. The record should so reflect. Thank you. Okay, that brings us to the second business item. We have our own Cumberland Perry County Drug and Alcohol Commission Community Advisory Board action. We have our director, Jack Carroll, here, who's going to present some information to us for possible action and certainly for discussion. So, Jack.
Okay, thank you, commissioners. As you know, one of the top priorities of our department for many years now, 7 to 8 years, has been addressing the ongoing opioid health crisis in our counties and in our state. And we've had some successes with that, but we were also experiencing setbacks when the COVID-19 pandemic occurred as well. I have included as a handout the chart that you're well familiar with now. You get a running tally from the county coroners from Cumberland County, Charlie Hall, and Perry County, Bob Ressler, about the overdose deaths that are recorded within the county boundaries. And this is one metric we use to gauge our progress or lack of progress. I'm happy to report that since the pandemic the COVID pandemic has been put somewhat at bay, certainly not gone, but it is mitigated, and people are now able to attend in-person counseling sessions, in-person support groups again. We're seeing a decline in overdose deaths. And those same measures that we've been operating with for several years continue to be in place and have a positive impact. But the numbers are still too high to be accepted. And we're always looking for what else can we do. One of the things that is being considered now is something called syringe services programs. These are programs where somebody who uses drugs by injecting them can come to a public health facility and turn in their used or dirty needles and receive clean needles at no cost. They can also then receive access to some free health services, some testing for HIV or viral hepatitis. If they test positive, it can be linked up with treatment services. Syringe services programs are primarily a public health strategy to prevent the spread of HIV, hepatitis C, other forms of viral hepatitis. And they've been shown to be successful in that regard. They are sometimes confused with another program known as supervised injection sites. Syringe services programs are not supervised injection sites. It's not a place where someone can go with their drugs, inject them, and be medically supervised. That program is much more controversial. And that is not what a syringe services program is. In many states, syringe services programs have been in operation for decades, and they've shown to be successful in reducing the spread of HIV, viral hepatitis. They've also been successful in research indicates that individuals who take advantage of syringe services programs are 5 times more likely to accept a warm handoff, a brief intervention, and a referral to drug and alcohol treatment services. That's the tie-in with preventing overdoses. If we can get some of the folks who are using opioids by injecting them to take advantage of syringe services programs, it's another opportunity for us to attempt an intervention and a referral to treatment for them. Right now, because of the way Pennsylvania's laws are written, syringe services programs are only legal in Philadelphia and Pittsburgh. Quite frankly, I don't quite understand why. It does seem like Philadelphia and Pittsburgh always get to operate with a different set of rules than the rest of us. But I'm told that it has to do with the size of their county, the size of their cities, and the fact that their city health departments have independent authority to authorize those programs. There has been legislation proposed in Pennsylvania. There's a couple of different bills, one in the House and one in the Senate, that would alter the state's paraphernalia laws to make syringe services programs legal. Right now, it's technically illegal to distribute needles, clean needles, under Pennsylvania's drug paraphernalia law. So as we're looking for what else can we try to further reduce the number of overdose deaths, this is one strategy that seems to have some promise. A few months ago, our community advisory board had a guest speaker, Roseanne Scotty, a consultant for the Pennsylvania Department of Health, came in and she talked about syringe services programs. And our advisory board was impressed with that presentation and wanted to know what, if anything, they could do to help further the chances of giving the rest of the state at least the option of being able to offer syringe services programs. Not a mandate, but at least having that option. And what she suggested is that the advisory board could add its name to a long list of statewide organizations, primarily health organizations, medical organizations, some drug and alcohol treatment agencies that are endorsing Pennsylvania expanding access to syringe services. That's one of the handouts that I included for you. That list is now over 150 organizations. And so they've asked to do that. But I pointed out to them that they are not a separate decision-making board. They are advisory to two sets of county commissioners, you and the Perry County commissioners, and they don't have the authority to take a separate position on their own. So they asked me to come and present to you and to the Perry County commissioners this request on their part to add not the Board of Commissioners name, but the advisory board's name to this list of organizations that are supporting an expansion of the syringe services program. Why don't I shut up for a little bit and see what you think?
Jack, I see very few county affiliated organizations
Yeah,
on this list.
I'm not quite sure why that is. I don't know.
There's medical societies, and that's about it.
It's mostly medical groups, and it may be who the Department of Health has approached with. I don't know. But it is primarily medical groups. And remember, this is primarily a public health strategy for reducing HIV and viral hepatitis. So that could explain the
So let me ask this. You've mentioned and the documents mentioned that there is, doesn't quite use the word strong as evidence or proof, but it essentially implies there are correlation between this program and reductions in the issue.
spread of HIV, spread of viral hepatitis, and there's
So is there any empirical data? For instance, we have 2 urban centers in this state that are allowed to do this. The rest of us are not. So do we have any comparative data that will show a little bit more proof rather
I don't
than?
know. I don't know whether we have that data or not.
Okay.
those areas.
All right, I don't mind telling you, I'm a little reluctant on this simply because, and I know it's, a position that's been criticized, and where it's been espoused, but, these have been characterized by many people as simple enablement of a continuation of the problem. And I do see some of the prospective benefits that are listed here, and I think they're very logical that they would occur. And there is simply the fact that refusing to provide them clean needles is not probably going to persuade someone to stop injecting themselves with something that they are addicted to. So there's that practical element. But I have to tell you, the issue of enablement, I think, is something that cannot be ignored.
I think that's a very legitimate question. And when I presented this to the Perry County Commissioners, one of their commissioners really had a very similar question. And what I would say is this definitely falls into the category of what's referred to as harm reduction strategies. It does not address the underlying addiction, the opioid. It does so indirectly by providing an opportunity to refer someone to treatment. It's primarily directed at preventing the spread of communicable diseases.
Yeah. So let me return to my original question, which is, there's the old saying, correlation does not equal causation. So we've seen implication that there's a correlation between reduction and the existence of this program. What we have not seen is correlation. That's why I've been asking about, is there empirical data? Because we do have that comparative opportunity within the Commonwealth here because of the existence of the programs somewhere.
I don't know whether that exists within Pennsylvania. I do know that in the other states that have been doing this for years, they claim that they do have hard data showing a reduction in HIV, in viral hepatitis. And that's where the figure that people who participate in these programs are 5 times more likely to accept a referral to treatment.
And yet the problem persists. So that seems contradictory.
Well, the problem is pretty complex. There's no, we've been trying multiple strategies. We've been continuing to address it through strong, consistent law enforcement. We've made great strides in changing the prescribing practices of physicians regarding prescription opioids, and I think that's had a positive impact. We've made treatment more readily available, particularly forms of medication-assisted treatment. We continue to educate the public. We've made naloxone or Narcan widely available, which incidentally is another harm reduction strategy that has been criticized as really just a form of enabling. What I would say is that I don't know that we can point to any one of those strategies and say, this is what's making the difference or isn't making the difference. The best that we've been able to do is come up with a comprehensive approach and hope that through the combination of all of those efforts, we are making a difference. And locally, it appears that that is the case because the numbers have been coming down with the exception of the climb during the pandemic, but now they're back on a downward spiral. Incidentally, that appears to be different from other parts of the country. We've been hearing that the numbers nationwide are continuing to climb. So I would suspect that there's something that Pennsylvania is doing that is positive. If I could, Gary, comment a little bit about the concept of enabling. I'm very familiar with that because really our field invented enabling. We preach that all the time in our community education programs. The person who's most likely to call our office first asking for help is not usually the person with a drug or alcohol problem. It's somebody who's emotionally close to them and who's been manipulated every which direction and is experiencing the pain of that. And part of what we talk to them and teach them about is enabling. Enabling is whenever you inadvertently protect somebody from the natural consequences of their drinking or their drug using behavior. And by doing that, you rob them of the opportunity to experience the pain that's associated with that addiction, with that disease. And you rob them of the motivation connected to that pain to maybe finally reach the point to accept treatment. So we get that. But we did face the same arguments when we pushed for widespread distribution of Narcan. Isn't that just making it that much easier for somebody to continue to use? You're giving them a safety net. And my response to that is, yes, you do need to be aware of enabling, and you need to avoid it when you can. But if somebody is dead, you're not going to have any further opportunities to intervene with them. A story that I've told in some of the town hall meetings, or an analogy that I've given, is let's say that you're going to McDonald's for lunch because you don't have much time, and on the way in, you notice a fellow finishing off his cigarette before he goes in. And you take a look at the guy and you notice not only is he smoking a cigarette, but he's pretty badly overweight. You think to yourself, that's not a good combination. That's your own. You go in because you're the picture of health. You order the salad and a nice clean bottle of water, and you sit down and you start to eat your very healthy lunch. And lo and behold, this gentleman who you saw on the way in sits down at the table next to you. And wouldn't you know it, he ordered the triple bacon cheeseburger and what appears to be a bushel basket of fries and a bucket of soda. And he started to consume this very unhealthy lunch. And again, you have a judgment in your head that say that's your own business. And in the middle of his lunch and your lunch, he falls on the ground and clutches his chest with an apparent heart attack. Right next to you on the wall is some AED equipment. And you know how to use it. You stop and say to yourself, won't I just be enabling this guy's bad life decisions of smoking, overeating, not exercising, not eating right? If I use the AED equipment, maybe you would think that, but I would hope that you would do the right thing. Save the guy's life, hopefully, and buy some more time for him. And that's what we're asking people to consider doing with these various harm reduction strategies. We know they, in and of themselves, don't address the addiction, but it may buy us some time for this person. And this syringe services program strategy has the added benefit of also preventing other problems in our community, the spread of HIV and the spread of viral hepatitis. I should mention that a recent news article that I saw said that Pennsylvania as a state still has the third highest rate of overdose deaths. And we have the 9th highest rate of new HIV infections. So this is something, a public health strategy that could help us address both. And again, we're not asking the Board of Commissioners to endorse this idea. We're just asking for your permission for our community advisory board to say that they support expanding.
What was Perry County's answer?
They said yes.
They did say yes. Okay. Was it a 2-to-1 vote or did they?
No, it was eventually a unanimous vote there.
And so, Jack, you're not asking us to illegally open our own program. What you're saying is, please let the advisory board sign on saying that they would support changing the law.
Yes.
Yeah, that's, yeah,
And that's not even saying that we would end up with a program.
correct.
Although I can tell you, I would be interested in having that as a job if it were. But that's not what this is about.
Jack, what did you just say in here? Your last sentence, what did you just say?
I said, if this became an option for our area, it's something I would want to seriously take a look at and see if we could add this to our personal strategies to try and address the opioid epidemic.
So I hear everything you're saying, and this is very complex, I understand. And let me ask, and correct me, don't let me put words in your mouth, but you're looking at this as an opportunity to get these people into real treatment.
Yes,
Okay, but
that's my buy-in.
yeah, and it makes sense. I agree with you. But still, if I was illegally injecting myself with drugs, I could come get clean needles, go home, no questions asked.
Yes, that's the way the program is set up. And what the rationale behind it is that if I'm the user and you're the program operative, I come in, that's the initial draw. That's probably all I'm interested in initially, but you establish a relationship with me across time. And building on that relationship provides the opportunity for you to persuade me to, hey, maybe you should get tested. Make sure that you're not, you don't have HIV or viral hepatitis, and you're not spreading that to the people you love. And while we're at it, what about treatment? Is this the life you want to continue? Have you ever tried treatment? And so you build a relationship with these injection drug users, and you use that relationship to eventually try to get them to take care of their health needs and hopefully accept a referral to drug and alcohol treatment.
Well, I continue to have questions about it. I don't doubt the intent. The intent is to get people into services. The question that remains is, are the outcomes matching that? So I understand a key motivator here is to have that contact so that provides the opportunity you just outlined. Do we know how often that actually translates into that? I mean, it sounds marvelous. I seriously question that those types of relationships develop, but I'm not in that field, so I don't know. I know this field's also suffer from enormous turnover, so you don't establish a relationship in that circumstance. But certainly it seems there should be some means of measuring how often those contacts translate into a placement or a referral into treatment or testing or whatever.
I don't have that data either. It is possible that data might be available because both Pittsburgh and Philadelphia operate pretty robust syringe services programs.
Yeah.
They may have some data available. And they are in a position, the federal government is actually offering funding to states to expand syringe services programs. And right now, only Pittsburgh and Philly are able to take advantage of that funding. So I can draw a parallel from our warm handoff efforts. We have a contract with Just for Today, Recovery and Veteran Support Services in Des Moines. They work with all 4 emergency departments in our county, and they respond to any drug and alcohol related call. An individual who shows up in the emergency department and drugs and alcohol are somehow involved. And this is a cold contact. These are people who were not expecting to meet with a certified recovery specialist when they made a decision to go to the emergency department. And so they're not the most receptive audience. But JFT has been successful in getting over 50% of them just through that one contact to accept a referral to treatment. So that would suggest even when there's not an ongoing relationship, there's an opportunity when offered to get people to accept a referral to treatment.
What's the attitude of the law enforcement community toward this? General.
I don't know at large. I can tell you that I did meet with Sean McCormick, our new district attorney, on another matter, and I asked him whether the statewide district attorneys association had taken a position. And he said that they had not, that he was aware of, and he was not aware of the program. And so I explained it to him. He did not take a position. Locally, the only other law enforcement person I've had a conversation with is Chief Landis, Carl Alber. And we talked about 2 different harm reduction strategies. One is a different one called fentanyl testing strips. And he was not in favor of that or had concerns and misgivings about that. But then when we talked about syringe services programs, he said, oh, I support that. Yeah, that prevents the spread of HIV. That's a good thing. So that was interesting, but that's a sample of one. So
Sure, yeah. Well, that's a significant one, though, in this community or this county. So
Yeah,
I appreciate
yeah,
that. It's providing some very good insights. I don't want to stand in the way of this today. I think that the positives sound like they outweigh the negatives. I'd like to know more about it. So if we can find some of that data,
I can ask.
that would be very helpful to me, and just personal knowledge and my comfort level with this. I think at some point it would be worthwhile to get a read within the law enforcement community. I know when Mr. Freed was the DA here, he spoke to similar issues when we were dealing with the opioid issue and said there is, there's a law enforcement aspect to this issue. And certainly we don't want people who self-report for treatment to then be referred to the police for prosecution, which would be self-defeating. But at the same time, the law enforcement community would welcome any opportunity to track down suppliers and things of that nature. And just as I was going to point out earlier, your example of McDonald's is very interesting, except one key difference is the gentleman who was smoking and eating McDonald's food was engaged in legal activities, whereas this clearly involves illegal activity. So we cannot ignore that aspect of the issue as well. So it would be very informative to know where the law enforcement community is moving on this issue, whether they recognize the positives as outweighing the negatives as well. So it's something for us to keep our eyes on. I'd like to make a thoughtful decision. So appreciate your answers to the questions.
Sure. Other questions or comments?
Jack, I was wondering if Miss Scotty would come in and talk with the three of us at some point in time.
She'll talk to everybody.
Yeah, and I will just add this.
She's on a mission.
She is. I would just add this. I have a brother who had a terrible addiction. I mean, he suffers from the disease of addiction. And I know I've told you this, Jack. And he's okay with me saying these things. He is doing well in recovery right now, but he OD'd at least 5 times, And I cannot imagine having had then the problem of HIV or hepatitis on top of what was going on with him. This really is a public health. This is a public health emergency, and anything we can do to help people to get into treatment, I think, is positive. And I really wish this law would change. And I am completely in favor of the commission adding to this.
There was a rally at the Capitol a week or so ago, and there was an article that appeared in Penn Live and some other affiliates around the state, and it quoted a woman who is in recovery but now works in the field, and she talked about how she used a syringe services program in Philadelphia, and when she first started using it, she had no intent whatsoever to get into treatment. She was just wanted the free needles. But eventually it was her pathway into treatment and into recovery. And so again, that's a sample of one. So that's not any empirical evidence. It's still pretty compelling first account. If you're interested, I can send a link to that article.
Yeah.
That's good.
Jack, in Pittsburgh and Philadelphia, is their program being federally funded since the state apparently is ineligible?
I guess it is. I'm not sure. I know that it could also be funded with private donations. Right now, you're not allowed to use public for this, but there could be a combination. They have a agency called Prevention Point Pittsburgh and Prevention Point Philadelphia, and they're the primary provider of these services there. But I don't know whether they're using state money or not. That's a good question.
It just says in the right up here, currently public funded SSPs only exist in Philadelphia, Pittsburgh. I don't know what that means.
Well, I think it means that there are some other programs operating with private funding in other parts of the state. There's a group called the Lancaster Harm Reduction Project that has no public funding at all, but they have been operating within the city districts of York, Lancaster, and Harrisburg to try to do harm reduction strategies, including syringe services programs. Unfortunately, I think syringe services programs have been confused with these supervised injection sites.
Yeah.
And that's given people a very negative image or idea of.
Maybe clarify that. I don't have any more questions.
Jack, just anything you have, especially with the medical community. I see there's a number of medical societies and how they reached that conclusion. So the anecdotes are fine, but you know, in engineering, there's an old saying that assertions without numbers are called an opinion. So it's a little data.
Somewhere the data that must exist, because I mean, it says here, SSPs are associated with a 50% decline in the risk of HIV transmission. I mean, no one just sat down and made that up. It came from somewhere.
Yeah, I think
This keyword is associated. Again,
Right, but the data had to have come, that had to have come from data somewhere. There's got to be some information somewhere about how that number came to be.
anything you can provide would be helpful going forward. So
and going forward, are the commissioners comfortable granting permission, making a decision, or holding for now?
I'm comfortable.
certainly up to the board.
Keith, this, if this is approved, we're approving the simple addition of the community advisory board to be added to a list of organizations that want to, quote, change the state drug paraphernalia law. There are no specifics.
Yes, you are authorizing that board to do that.
The final decision of any law change, however, would be at the state level,
Yes,
not the county level.
correct.
And that would be a legislative decision.
So they just want the right to weigh in on their opinion of a proposed state law.
Yeah, your opinion, not your opinion.
That's how I'm reading it. I have some hesitation, but I support it.
Do we need a motion on it?
What should be appropriate if we want to take action.
Well, then I will move to approve to add the Cumberland Perry County Drug and Alcohol Commission Community Advisory Board to the list of organizations that support changing Pennsylvania's law to allow for an expansion of syringe services programs.
I'll second.
Okay, it's moved and seconded. Any further comment, question?
I have a comment, sir.
It's really for the commissioners, but I'll allow you.
Okay.
I'll allow you a minute to speak to it.
Okay, the opioid thing that we have going on here was prescribed by the doctors. They overprescribed opioid. They turned around and after it became illegal or uncomfortable for them, they cut the people off. And then the people went out on the streets and started getting fentanyl. And that's where your addiction problem came from the medical establishment to begin with. I have a friend that went to a doctor and they said, well, here you go, you can have some opioids, you can have some, opioids. And he said, no, he didn't want to do it. So then later on, he went back to the doctor after the laws got a little hot for the doctors and said, well, I need something for pain now. They said, all we can give you is, an aspirin or something. So this has actually been brought on by the medical establishment themselves. And then after it became hot for them, they turned around and said, we're not going to give you anything. A man that's addicted doesn't think rationally. He's going to go and get his fix anywhere he can. And if that means using dirty needles or getting fentanyl on the street that is to the point that it will kill you when you use it, he's going to do it because he doesn't care. The cravings are so great. So the addiction has to begin with doctors stop providing this to begin with. And then the fentanyl on the street where law enforcement just jumps right down their throats. You know what I'm saying? Because fentanyl shouldn't be on the streets at all. It's a dangerous drug. And they're using it to replace the fact they can't go to their doctor and legally get their opioids.
All right, thank you for your comment. I would just add one thing to that. The issue's been widely discussed among the board. It is worth recognizing that the medical community certainly has become complacent on the issue. I recounted myself going to the dentist and him essentially saying, here, you just take it. I'm like, I don't want this. And he said, oh, it'll make your back feel better because I have back problems as well. There's a great complacency. It is worth noting that some of that has been affected greatly by federal government policies in which pain management became a major performance measure for the medical community. And managing pain is something that has heavily impacted the reimbursement policies. So the medical community is responding as well to pressures from the federal government. So there's a number, it goes to Jack's point, these are complex issues. There are a number of drivers on the issue. So I just think that's worth noting that there's plenty of blame to go around. With that said, we have the motion, we have the second. If there's nothing further, we'll call the action. All in favor indicate by saying aye.
Aye.
Aye. There are none opposed. The motion carries unanimously.
Thank you very much.
Thank you for the answers and the discussion. So, okay, that's all on that issue. I presume we'll move on to item 5, which is other business. Is there anything additional to come up with?
No.
Okay, with that, I'll entertain a motion for adjournment. We stand adjourned. Thank you.